can listen. Okay, welcome, Dr. Yu. 歡迎余醫生。
Thank you, Pastor Sam. I'm so glad that I have this opportunity to come back to share with you about COVID-19. And as you know, this infection, this pandemic had been with us for almost, I would say 20 months now. And it goes through definitely ups and downs. You know, there are times we thought we can control this pandemic and there are times we cannot. And I think having an understanding how to deal with this pandemic will be benefit to our community. And so today I'm going to talk about what's going on, what's the latest on the vaccine and on the Delta variant.
今日好開心啦，我就有機會翻嚟同大家去分享關於一個新冠疫情同埋疫苗嘅情況。咁我哋事實上已經喺過去20個月入邊咧，受呢一個嘅病毒嚟到影響。咁我覺得而家係一個好重要同埋好恰當嘅時間，我哋再睇翻呢個變種嘅病毒對我哋嘅影響，同埋我哋點樣嚟到去應付嘅。
So I really label today's talk as something we call invisible enemy because we cannot see this virus, but we know they're there because people see that they're being affected. And more important, the virus have changed to a strain we call the Delta variant that become more infectious and more deadly.
今日我呢個講座題目咧叫做隱形嘅敵人，因為呢個敵人咧我哋見唔到，但係佢對我哋咧有好強、好深遠嘅影響。咁特別其中就係一個叫做 Delta 呢個變種嘅病毒，所以咧我哋好想趁呢個機會同大家去深入去講翻呢一個嘅隱形嘅敵人對我哋嘅影響，同埋我哋點樣去面對佢，點樣去防範佢等等。
So just give us some statistic. If you look at the graph here, back in June, we have about 12,000 cases per day in the United States. By July, this case went up to 60,000 per day. And by August, just this month, we are 100,000 cases per infection per day.
大家睇一睇一啲嘅數字。今年6月咧，我哋嘅被感染嘅個案咧有12000宗每一日，但係去到7月份嘅時候咧，平均每一日就升到6萬宗，而去到8月嘅時候咧，即係呢個月份啦，就係有每一日平均有成10萬嘅個案。
And one of the driving force to this is because we have only 51% of our population in the United States are fully vaccinated.
其中一個主因就係我哋喺美國只係得51%嘅人口咧係接種咗疫苗。
What causes this increase? Besides not being vaccinated, one of the most important thing is we saw this variant strain called the Delta hitting the United States back in May.
我哋見到另一個好重要原因咧，就喺5月份呢一個叫做 Delta 嘅變種病毒嚟到去影響美國嘅人。
As you may remember, Delta was first seen in India, caused a major issue in India. The highest caseload per day in India was 400,000 cases per day.
大家都可能記得呢一個Delta 變種嘅病毒，最初係喺印度發生嘅，嗰處咧平均每一日有成40萬個個案咁多。
And in May in the United States, if you look at the right here, we only see about 1% of all infection. But by July, we are 93% of all infection. And by August, it's hitting about 99%.
你都見到同樣類似嘅情況喺美國發生。5月份嘅時候咧，我哋佔嘅因為一個 Delta 變種而有嘅只係1%，去到7月啦，已經係有成93%，而8月份嘅時候咧係99%咧都係因為呢一個嘅變種嘅病毒引起嘅病。
And we can estimate the Delta can doubling every 3 to 4 days.
因為呢個 Delta 嘅變種咧係每3至4日咧就會倍數咁樣嚟到增加。
So if you look at the graph on this side, you can see when we first have COVID-19 hitting the United States back in March, these are the cases in the United States. We have 20,000, we have 40,000. We went up to close to 70,000. Then by the winter months, we're hitting us really badly in the United States, up to almost 300,000.
你見到嗰個過去20個月發生嘅情況，由2萬7萬去到差唔多成20多萬個個案咁多嘅。
Then with vaccination, with control, with social distancing, you see this sharp drop. By probably around April, we see this exciting drop. We thought, hey, the pandemic might be over. And in middle part of May or June, we see it down to almost less than 10,000 cases in the whole United States. Then right now, we're going back up. We surpassed when the pandemic first started.
你都見到啦，由今年開始咧，嗰個疫情個數字就大幅下降，因為最主要原因咧，我哋加強咗嗰啲嘅防禦措施啦，亦都咧我哋開始接種疫苗啦，咁所以咧嗰個數字一路嚟到下降，去到一個谷底咧係少過2萬宗差唔多係1萬宗咁多嘅。咁係到後來咧，過去呢幾個月，因為嗰個變種嘅緣故咧，又再一次嚟到上升，好似剛才所講嘅數字。
So let's bring it close to home. We just look at statistics of San Francisco. And if you look at the peaking of the COVID-19 back in January, we have about 276 average cases per day. And hospitalization is about 250 per day in our hospital here in San Francisco. At that time in January, we only have about 37,000 patients are vaccinated.
我哋可以睇一睇我哋三藩市嘅情況，喺今年嘅1月份，平均7日即係每一日嘅數字咧276度，跟住入院嘅數字245，而接種疫苗咧係大概37,000宗，37,000個人次。
Then in between time, meaning around April or May, there are days we have 0 patient in the hospital, maybe about 10 to 20 cases a day. We were so excited. We thought, hey, we are really controlling this vaccination, this pandemic because of what we're doing. We did really good in vaccination. We're hitting about 80%.
喺大概今年嘅4月份左右啦，我哋見到入院嘅情況都係大幅下降，到大概每一日10零至20個個案。咁我哋諗住咧，呢個疫情咧係受到好大嘅控制。
Then in July, starting July, we see a turn again. And by last week, we average testing positive in San Francisco County is about 235 cases per day. And right now in the hospital, there's over 111 cases admitted to the hospital. Although the vaccination rate is up to 673,000.
但係我哋喺上個月，即係7月份開始啦，見到咧係感染嘅人數咧再一次嚟到上升，去到咧235每一日。另外入院嘅人數咧亦都去到110多。咁雖然我哋嗰個接種疫苗嘅數字咧係已經大幅增加到67萬多嘅人數等等。
But the concern is this 111 cases, about 90% of them are unvaccinated.
而喺110人裏邊咧，接近90%嘅人咧係未接種疫苗嘅。
So you can see this is the curve that we can see in the United States overall. You can see the case loads. The dot that you see here is hospitalization are going back up again. And the reason why is, again, we have 80% vaccination, but whole United States is different. Certain states have as little as 30 to 40% are vaccinated.
我哋冇錯喺三藩市咧，我哋接種疫苗嘅人數好多，大概有80%到，但係整個美國咧，只係講緊係30%左右嘅人係接種咗疫苗。
So I'm going to shift gear and talk about some classification. Because this virus are changing so rapidly, so CDC and World Health Organization start classify what are these variants. So they have 4 classifications. One they call variant under investigation. These are the variants that came about. We don't know how significant they are. Do they are not so smart variant? They just come and they disappear, and we don't have to worry about it. So they are still under investigation.
事實上咧，我哋呢一個嘅聯邦政府CDC 啦，同埋呢個世界嘅健康組織咧，你都再重新嚟到去將呢啲嘅病毒又將佢分類咗，包括咗第一個咧叫做VUI， 就係咧一啲嘅變種喺一個調查嘅當中，我哋未係好知道好清楚究竟呢個病毒嘅變種咧對我哋有啲乜嘢嘅影響嘅，所以叫做 VUI。
So the other classification is variant of interest. These are the one that we see some outbreaks in certain part of our states, maybe some other country, but they haven't really had a major impact yet. Although they may become more severe, they may become more infectious, but we are monitoring. Currently, CDC is monitoring 3 of these variants.
另一個咧叫做 VOC。咁呢個咧就係對我哋嘅美國或者其他地方咧都有一啲個別嘅受影響嘅個案，咁但係咧未去到一個地步咧係非常之傳染性好高嘅。咁我哋美國嘅 CDC 啦，亦都咧喺度繼續嚟到去監察緊，其中有3隻嘅變種嘅病毒。
And then finally, another one we call variant of concern. These are the ones that concern us. They are here. They are causing a lot of infection. They're causing major outbreak. And Delta is one of this. In United States, actually, the CDC is following 6 of these variants. And right now, the current one that we are most concerned, of course, is the Delta variant.
咁另一種啦，就係咧叫做 VOC， 就係值得關注嘅變種病毒。咁其中有6種嘅。咁而家咧亦都係影響緊我哋，包括咗呢個叫 Delta 嘅變種病毒啦。咁所以 CDC 咧，即係我哋嘅美國政府咧，好密切去留意住呢啲叫做 VOC 嘅變種病毒。
And finally, the last one that we do not want to see, which is variant of high consequence. These are the one that the vaccine is not going to work. The drug that we have is not going to work. Nothing will work. And this virus will just go across the whole community, the whole country. Potentially, it can destroy every single person because there's nothing to fight them. Luckily, so far, we have none so far.
最後呢一種咧叫做 VOHC， 就係咧有一個非常之巨大嘅後果嘅變種病毒。呢樣嘢係我哋極之唔想見到嘅，就係因為嗰個影響係非常之大。咁感恩嘅係暫時都冇呢啲咁嘅情況出現。
So I'm going to talk about VOC, variant of concern in the US. As I mentioned earlier, there's 6 of them.
我就會集中嚟到講呢個叫 VOC， 就係值得我哋關注嘅變種病毒。喺美國咧，又或者係普遍嚟講咧，有6種嘅。
If you remember the last talk that I gave back in sometime, I think in March, we were anticipating the Alpha, which is from UK, United Kingdoms. And we kind of anticipate Alpha by mid-March will become the most dominant variant in the United States.
大家仲記得嘅話咧，我上次同大家講咗就係今年嘅3月啦，我就講到咧，當其時有一個叫做 Alpha， 即係嗰個變種病毒係嚟緊嘅啦，咁我哋都係好關注嘅。
Yeah, one thing I point out, people get confused. How come in the past we talk about variant from UK, a variant from South Africa and Brazil? CDC and World Health Organization decide we should not use the name of a place where they would discover as being the name of the virus. And therefore now we're using these alphabet, we're using alpha, beta, gamma, and which is the right thing to do. Likewise, we do not want to call the original virus the Chinese virus or the Wuhan virus, but we call it the COVID-19 because we don't want the location to associate with a virus.
呢度我要澄清少少啦，因為可能大家都聽到咧，就係話嗰啲嘅變種病毒喺某某國家嚟嘅，咁而事實上 我哋美國政府 CDC 同埋以至到世界嗰個健康組織WHO 咧，亦都係再重新命名呢啲嘅病毒，就唔係話嗰啲嘅病毒咧喺邊一個國家而嚟，而係根據一個叫做希臘嗰個字母啦 alpha 啊等等咧嚟到去編排嘅。
Mm-hmm. So if you look at this graph right here, look pretty busy, but it's really simple to understand. Back in May 8th of 2021, if you see the majority of the variant is Delta. This light orange here, this is all the caseload of Delta in the United States back in May 8th.
Oh, you mean Alpha, right?
Oh, I'm sorry. Yep, Alpha. Thank you for the correction. Yeah. This is the Alpha back in May 8th.
OK， 呢度咧就大家見到一個圖表啦，就係講翻俾我哋聽呢6種嗰個嘅變種病毒對我哋嘅影響嘅。去到啱啱5月頭嘅時候咧，今年5月嘅時候最多就係一個叫淺色呢一隻咧，就係叫 Alpha 嘅。
Mm-hmm. And then the second most is the one from New York we call Iota, which is the purple color right here.
而第二多嘅就係紫色嗰度啦，嘅叫 Iota。
And if you look at this dark orange right here, there's only about maybe no more than 10%. That is Delta.
然之後咧就係深橙色嗰度咧就係而家我哋叫做 Delta 嗰一個變種病毒。
But you see a week gone by, Delta got more, all the other ones get a little bit less. And as time goes on, you see how this dark orange one, which is Delta, start taking over. And by the time we hit here, which is August 7th, we don't even see Alpha anymore. Look at this whole thing is Delta all the way down here. And this is called Delta Plus because the Delta continue to mutate. So by August 7th, Delta become the king.
你見到咧呢一個叫做圖表咧，係每一個禮拜有即係叫跟進嘅。咁你見到就係 Delta 嗰個變種病毒咧，就係深橙色嗰度咧，嗰個係變化得好犀利，突然間增長得好犀利。由而家已經係大部分係 Delta， 甚至乎咧有一個叫 Delta Plus 嗰個再深橙色啲嘅嗰個叫 Delta Plus， 都係由 Delta 演變而嚟嘅。
So as you can see, Delta is growing pretty fast. Back in those days, we were kind of concerned about Beta. Beta, as you can remember from South Africa, because Beta in South Africa, we found that the vaccine doesn't work too well, except for Johnson & Johnson. Both Pfizer and Moderna didn't work well. But luckily, Beta didn't really didn't hit the United States.
曾經有段時間咧，我哋都好關注呢隻叫 Beta 嘅變種病毒，就喺南非嚟嘅。因為咧佢淨係嗰隻叫做 Johnson & Johnson 嘅疫苗咧，可以先至抵得住佢，而其他譬如話輝瑞啊等等嗰啲疫苗咧，就唔能夠可以即係打低呢個疫苗。但係好感恩嘅係呢個 Beta 嗰個影響就好少。
Why is the Delta variant become the dominant variant just in about a month, 2 months in the United States? There's only 3 reasons. 1 is more transmissible. 2, it caused much higher rates of hospitalization. And finally, the vaccine are less effective in preventing infection.
咁我哋要問啊，點解呢個 Delta 變種病毒對我哋嘅影響咁犀利、咁廣泛咧？就係特別喺過呢2個月，就有3個好主要嘅原因。第一咧，佢係好高傳染性嘅，即係好容易咧傳染到其他人嘅。咁第二咧，就係當你受感染之後咧，亦都係有好高要入住醫院嘅情況，要入院嘅數字亦都好高。第3就係呢個疫苗咧，相對地係冇咁有效嚟到係抵禦呢一隻嘅變種病毒。
And finally, as I mentioned earlier, a little bit about Delta Plus. If you want to look into Delta Plus actually is the marriage between the Indian Delta and the South Africa Beta that didn't come to us. Somehow they are very similar. And that's why Delta Plus become a major concern.
另一個咧就係而家最近期好多嘅叫做 Delta 加或者 Delta Plus， 佢咧就係基本上就係 Delta 同呢一個嘅 beta 就係南非嚟嗰個 beta 咧，就一個即係走埋咗一齊，所以變種而成嘅。
Let's talk about why is the Delta are so contagious, so infectious. And one of the reasons, you have to understand virology or people who study viruses and bacteria. One of the things we study, we call R0. R0 is reproduction naught, how much they can infect you. And so that's the symbol that we use. The original COVID-19, which is from Wuhan, the infection rate is 1 person infect 2.5 person. So you have 1 person who got infected, 2.5 person will get infected. That's the original Wuhan virus that came in back in 2019.
呢一個咧，我哋再詳細了解下嗰個高傳染性係點樣嘅咧？就係因為呢一個咧，如果你研究呢個病理或者係病毒嗰個學理咧，你會知道咧嗰個叫做傳播率啊，即係 reproduction rate 嗰樣嘢咧，就係我哋去睇嗰個嘅影響有幾多人嚟到睇嘅。最初呢一個嘅冠狀病毒咧，就係一個人咧會傳大概係2.6個人咁多。
Alpha, the one come from UK back in March, that one become more infectious already. It's 1 to 4. That means 1 person to 4 people.
而喺嗰個叫做 Alpha 嘅變種病毒啦，英國嚟嗰隻咧就係話一個人就會傳到4個人嘅。
And look at Delta. Delta can infect 1 to 8.5 person. So 1 person infected by Delta, 8.5 person can be infected.
而 Delta 就更加厲害啦，就一個人可以感染到8.5個人咁多。
And if you look at the most infectious disease in human history, one is varicella, which is chickenpox, 1 to 10 person.
係啦，咁如果你睇翻一個歷史入邊咧，嗰啲嘅即係傳染病嗰個嘅感染數字啦，呢、這個叫做 chickenpox 中文係咩？就係一個影響就係水痘一個咧就影響10個人嘅。
Then the most infectious disease that we see in human history is rubiola or measles, 麻疹, 1 to 18 person.
係啦，另一個咧就係麻疹啦。你見到咧一個人係可以感染到18個人嘅。
And these are all airborne.
呢個咧就係透過空氣傳染嘅，呢兩種都係。
So anything greater than 1 to 8 is considered highly contagious disease.
任何咧，如果係一個人影響8個人以上咧，都我哋稱呼為咧一個高傳染性嘅病毒。
So in summary, this Delta variant are more contagious than SARS in 2003, MERS in 2009, Ebola, chickenpox, Spanish flu of 1918, and also the common cold that we get.
所以我哋話咧，呢一個變種病毒咧係比過去大概10多20年嘅各種嘅傳染性嘅病啦，包括咗 SARS 伊波拉其他一啲 flu chickenpox smallpox 等等咧，係更加厲害，甚至乎即係嗰個我哋一般嘅流行性感冒咧更加嚴重嘅。
That's why in social media, a lot of people said, don't worry about COVID-19, don't worry about the Delta, it's just like a common cold. I can tell you, it is not a common cold.
所以如果你聽到有人話咧，呢一個冠狀病毒就好似一般嘅傷風感冒咧，咁我就可以話俾你聽，呢個就絕對唔正確嘅，因為呢個傳染性係比傷風感冒更加嘅厲害。
One thing about this Delta is even fully vaccinated person, when they caught this Delta variant, they can spread the virus to others.
其中一樣嘢咧，就算係我哋嗰啲已經係打咗疫苗2針，即係全面已經打咗疫苗嗰啲朋友咧，仍然咧，如果係有機會咧去即係感染到呢個 Delta 變種嘅病毒，亦都咧係可以去傳播呢個病毒俾其他人嘅。
In other words, let's say I am vaccinated, I'm fully vaccinated. Let's say I caught the virus, I caught the Delta. I can spread it to more than 8 people around me.
假設如果我係咧就算我打咗疫苗，但係咧我感染咗呢個病毒，我仍然有機會咧係傳俾8個人以上嘅。
Yeah, the only good news is my ability to spread to other only short-lived, maybe 2 to 3 days.
即係值得慶幸嘅咧，就係我影響其他人或者傳染俾其他人嘅可能咧，就會減少咗嘅日子，去到大概2至3日度。
As compared to unvaccinated, they can spread the virus up to 7 days or even 10 days.
相對於嗰啲未打疫苗嘅人咧，佢哋講緊係會傳染喺7至10日裏邊咧，仍然係可以傳染其他人嘅。
And one study looked at an outbreak of Delta in the United States. They found people who are vaccinated, we contain the same amount of virus in our body that can spread to others as somebody who are unvaccinated. In other words, the virus lives in my nose. If I get infected and I'm vaccinated, I have the same amount of viral load compared to somebody who are unvaccinated.
根據一個喺美國嘅研究咧，就係無論你打咗疫苗或者未打疫苗都好啦，我哋帶嗰個病毒嗰個量咧都係相若嘅。咁所以換言之咧，你打咗疫苗或者未打疫苗都好啦，你都可能成為一個嘅傳播呢個病毒嘅媒介。
And the infections are much quicker. The original virus take about 5 to 6 days before you get sick and infect others. Delta variant 2 to 3 days.
呢一個變種疫苗咧，只係需要2至3日咧，就令到其他人受感染即係成啦。咁而原先嗰個病毒咧係需要長啲嘅時間，5至6日嘅。
Because of that reason, we start seeing the Delta. Also, the data show people who are infected by Delta, they do get more seriously ill if you're unvaccinated. And you also get sicker and quicker compared to people who are vaccinated.
亦都係因為咁嘅緣故咧，特別係如果你係未打疫苗嘅朋友，你假設係中咗呢個疫苗嘅時候咧，你受影響嘅程度咧係會更加大，你更加之病得嚴重，同埋更加快係有一啲嘅病徵會出咗嚟。
If those of us who are vaccinated and caught the virus and get infected by virus, our symptoms are mild, and the duration of illness is only about 3 to 5 days.
而至於嗰啲已經係打咗疫苗嘅朋友，嗰個影響咧，亦都係比較輕微嘅病徵，同埋嗰個時間亦都係短啲，係大概3至5日左右。
I have a patient about 2 weeks ago. He came to me. He's fully vaccinated, and he doesn't feel well. He feels tired. His nose is stuffy, a little bit sore throat. He kind of concerned because he told me he went out to a steakhouse, a lot of people. So he doesn't feel right. So he came in and he tested positive for the Delta variant. And fortunately, his symptom was mild. And about 3 or 4 days later, I follow up with him. He's fine already. But of course, all the family member, people he associated with had to be tested.
我最近有個個案啦，就係有個病人大概2個禮拜前嚟睇我啦，咁佢話有啲唔舒服，因為咧佢即係亦都諗翻去過一啲餐館食飯，咁嗰度咧好多人喺樹，咁果然即係佢做咗個測試之後咧係有一個變種嘅病毒，咁但係嗰個影響咧都係短暫嘅，即係大概4至5日到啦，佢嗰啲病徵已經冇晒啦。
Yeah, the number of breakthrough cases that we see now is probably underestimated because a lot of people probably caught the Delta, but they don't have symptoms or very mild symptoms. If they thought, oh, maybe just allergy and never get tested, in 3 to 5 days, they are better. So we think the number of breakthrough cases are underestimated.
我哋亦都相信咧，因為一個嘅即係實際受感染嘅人咧，可能同我哋有嘅數字咧係有個差距嘅。實際受感染嘅人咧係往往係更加多，因為佢哋嗰啲嘅病徵都係好少，甚至乎係冇病徵，咁所以咧佢哋就冇去接受任何嘅測試。
Now, I'm going to stop here a little bit. I saw somebody raise up the hand. Am I supposed to answer questions now, or should we hold on to later?
What do you think? I think we can address a few questions. How do you think? Yeah, and then we can
do that.
Okay.
Did somebody have hands up for questions? Or?
Okay. 係咪有人有問題咧？你可以開個咪嚟到去問嘅。 Is that Anthony? I see Anthony raise a hand. Okay, Anthony, you can unmute yourself and ask your question. 你可以開個咪嚟到問你嘅問題啊 ，Anthony。Okay. If not, then we just continue.
Yeah, we just go on. Maybe it's not a
oh, I saw one question from Lawrence. Yeah, Lawrence, go ahead. Unmute yourself. 開咪啦。係啦，你未開咪啊 ，Lawrence。係啦。
嚇，聽唔聽到啊？
聽到。
我想問下咧，打中國嘅科興啦，對呢個 Delta 咧，有冇效㗎
？OK。
呢個問題咧，我唔能夠答到，因為咧我唔係好知道第啲 vaccine 嘅好處同唔好處。但係我認為咧，我遲啲再繼續講咧，我哋知道點解呢個 Delta 會 break through 呢個 vaccine 咧，咁可能你會明白到 probably 都有啲效，但係我唔能夠可以好肯定，因為我即係冇嗰個 vaccine 嘅資料啊。
Okay. So the question is about some other vaccines. So because Dr. Yu doesn't have those information, so he cannot fully answer that. But he will address whether and to what extent the vaccines are effective to deal with the Delta variants and other variants as well. Thank you. Okay, one more question is from in the chat room. Which vaccine is better to protect from Delta, Pfizer or Moderna?
Okay, and that answer will be answered always going to the side. When we talk about vaccine, you're going to have an answer. Okay?
Yeah. 我諗就係如果同嗰個疫苗有關咧，我哋一陣間余醫生都會講噶啦，咁可以暫時忍一忍，我哋再問嗰個問題。Okay, one more question from Fanny。Fanny， 你想唔想開咪？
係我想問咧，我有個朋友啦，佢係以前係infect 過 with 呢個 COVID-19 嘅。咁佢咧就而家係8月啦，佢應該係5月嘅時候打咗第一針，咁跟住咧佢就冇打第二針。咁如果佢而家再去打嘅時候去打 vaccine 咧，佢需唔需要又打翻第一針同第二針，抑或係打第二針？
佢唔需要，佢淨係打第二針，因為佢個 study 睇到咧 infect 嘅人咧，佢已經有啲 antibody 喺度。好多時我哋過咗3個月之後 90 days 之後叫佢再打一支咧，佢應該保護到，所以佢唔需要從頭再打過嘅。
OK， 咁佢就係打第二針得啦。OK，Thank you。Anytime 都得。
So the question is, someone he or she got affected some time ago, and then the person got the first shot. Whether she is now to take a second shot or she has to take the 2. So the answer is just take the second shot, right?
Thank you.
Now, so as we go on, so the breakthrough infection is underestimated. But again, we can see in the hospital, those who are hospitalized right now, the 111 cases in San Francisco, they are 90% are unvaccinated.
頭先我講過啦，就係而家大概有111人咧喺三藩市每一日入院嘅，咁呢90%以上或者以上嘅人咧，佢哋都係未打疫苗嘅，所以咧就有咁嘅情況出。
And also one interesting thing that we see in the hospital, back in winter or last year, the average age of people admitted to the hospital, they are in the 60, 70, 80, 90. But right now, currently in San Francisco, the average age is 40s.
另一個值得注意嘅數字咧，就係上年入院嘅人咧嘅年紀都係偏大嘅，譬如60啊、70啊、80歲等等。但係最近呢一個嘅疫情咧影響嘅人咧，多數都係40零歲入院嘅人。
This is not because the Delta attacked younger people. The reason why is due to the younger person had lower vaccination rate.
呢個唔係因為嗰個嘅病毒係要針對年青人，而因為呢啲年青人好多都冇去打疫苗，所以有咁嘅情況出現咗。
And people are concerned because right now the vaccine is only given to people who are 12 or older. How about 5 years old or older, or the younger kids? But hopefully, I think CDC will approve the Pfizer vaccine for 5 to 11 pretty soon within the next month or 2 months.
呢一個亦都會引起一啲人嘅關注，就係嗰個歲數啦。咁我相信咧嚟緊政府咧就會批准5歲以上嘅小朋友啦，亦都接受呢個嘅疫苗嘅。
Okay. One of the things we see about the Delta is the Delta, if you look at in India, when we look at in UK, it go through the country really rapidly, a lot of sickness, but they peak pretty rapidly too. By about 3 months or so in India and also in UK, they peak. And we are hoping in the United States, we estimate the peak may come in September.
冇錯，嗰個變種病毒咧影響係好廣泛，譬如話喺印度或者英國。咁但係咧，我哋都慶幸嘅咧就係嗰個影響嘅時間啦，亦都係有限，大概係2至3個月咧就去到最高峰啦。咁之後咧嗰啲嘅個案亦都會即係緩和即係減少咗嘅。咁我哋希望喺美國嚟講，呢個 Delta 嘅變種病毒，佢去到9月中度咧就係去到最高峰，之後咧就會緩和落嚟啦。
To achieve the peak, of course, we don't want to peak at 400,000. Hopefully, peak at 200,000, right? So less patients are being sick or even death. So to achieve the peak earlier and lower, we must follow 2 rules. One, of course, is public health mandates. That's the reason back in August, we are asked to wear our masks again, social distance when we go indoor, and at the same time, our own behavior. We have to willing to wear masks. We're willing to social distance. And if we don't feel right, or if we've been to an area we're concerned, we need to get tested, regardless you have symptoms or not. Because if you test positive, we want to quarantine you because you're potentially, regardless you're vaccinated or not, you can spread it to 8 other people.
呢個咧亦都係我哋話希望嗰個嘅到達最高峰嘅時候咧，嗰個數字盡量減少啦。我哋唔希望每一日有40萬嘅個案，即係盡可能減少到。咁有咩可以做到咧？有2方面。第一就係喺一個公眾嘅裏邊啦，我哋有嗰啲嘅措施啦，好似之前提到咧要戴口罩啊、社交距離等等。咁另外一方面啊，就係我哋個人嗰啲嘅社交行為，包括咗我哋要戴口罩啦、保持社交距離啦。如果有懷疑嘅，去接受測試。同埋咧要如果係確認咗有嗰個冠狀病毒咧，就要自我隔離等等。
Yeah, I kind of like to explain what is exponential growth of the virus or Delta variant. I'm going to give an analogy. The analogy is, let's say if I give you $1 million, that's a lot of money, right? That's enough money to buy a house, except in Bay Area, you can't buy a house with $1 million. You have $1 million. On the other hand, I'm going to give you a penny a day, but each day I double your penny. So the first day I give you a penny, second day I give you 2 pennies, third day I give you 4 pennies, then I give you 8 pennies. Do you know in 30 days, you're going to get more than $5 million if you do the math?
我咧就好中意用一個比喻嚟到去解釋乜嘢叫做嗰個幾何級數嘅增長啊。就係咧一個咧就係我俾一次過俾100萬蚊你一次過，咁另一個方面咧就係我每一日俾1個 penny， 跟住第2日咧就雙倍，即係第2日咧就俾2個 penny， 第3日俾4個 penny， 如此類推。你知唔知1個月之後咧你會有幾多個 penny 咧？或者係加埋有幾多咧？就係數以百萬計嘅錢嚟嘅。
So you can see the viral growth is exponential. So they go really quick, they affect a lot of people, and therefore it is a pretty scary number.
所以大家見到呢一個嘅變種病毒嗰個影響咧，就係一個好大嘅影響，一個幾何級數嘅影響，所以亦都係令到人哋係關注嘅。
Okay, the next slide is a little bit more technical, but I think it's so important for us to understand how did the Delta variant become what it is? How can the Delta variant can resist or become less effective against the vaccine that we have?
呢一個咧，呢張嘅即係投影片係好緊要，但係亦都係有少少即係技術性多少少嘅，但係亦都係好重要嘅，就係關於呢一個嘅變種病毒啦，點樣嚟到同我哋個疫苗之間嗰個嘅即係產生嗰個嘅互動係點樣嘅？
You know, the main thing about the COVID-19 or the SARS-CoV-2 is really about the spike proteins.
呢個冠狀病毒好主要咧，我哋就話咧受嗰個叫做刺突蛋白嚟到去影響嘅。
The spike proteins allow this Delta variant to be infect you faster, get you sicker quicker, and get you sicker faster, quicker, and sicker.
呢一個咧好似針刺嘅蛋白咧，就令到我哋特別一個變種嘅病毒更加傳染得快，更加咧係好短時間，同埋咧嗰個病情係好嚴重嘅。
So if you look at this picture, this is what the outside of the COVID-19 looks like, the coronavirus looks like. And this red thing here is the spike protein.
呢個就係一個嘅嗰個叫做冠狀病毒嗰個嘅即係組織啦，紅色嗰個咧就係叫做即係嗰個刺突嘅蛋白或者突咗出嚟嘅。
If you look at the spike protein, it actually have 3 parts right here. If you look at it in a molecular level, there's 3 leaves or 3 prongs if you're right here.
如果我哋再微細咁樣去睇嘅時候咧，呢一個咁嘅刺突蛋白咧，就好似有3塊葉或者三方面咁樣突咗出嚟嘅。
So if you look at it, those 3 prongs is actually, we name it. We have a name for it. It's called protomers. And there's 3 of them. The function of the protomer is really help you attach to the cell.
呢3塊咁嘅好似葉狀咁嘅嘢咧，有咩作用咧？就係嚟到好似去黐住另一個嘅細胞。
So if you look at this picture here, this red thing is the spike protein from the COVID-19 virus. The green is the human cell, our cell. And these are the receptor, the natural receptor from our cells.
你見到咧右邊嗰個就係冠狀病毒，左邊嗰個咧就係我哋身體嘅細胞，嗰個咧就係我哋接收外來嘅嘢嗰個嘅地區。
So this 3 prong grab onto our receptor. Once it grab onto it, let me go back. It transmit their own genetic material into the human cell, and the human cell will follow the direction and produce all the little COVID virus, and they will blow up the cell, and then there's many of them, and then they will attack more cell and more cell and more cell.
呢個咁嘅3隻手掌咁嘅嘢咧，就會當接觸到人類細胞嘅時候咧，人類細胞就會俾佢黐住咗，跟住呢個冠狀病毒入邊嗰啲嘅病毒咧，就會透過咁樣嘅時候咧，就傳遞咗去一個人類健康嘅細胞。
So if you look at the Delta variant, the first mutation they have is so-called the D748k mutation. What it does is the 3 prong, the pronomer, they open up. The one on Wuhan is closed up like closed, harder to attach to cell. Now they learn to open up and able to grab the cell receptor much easier.
呢個我哋了解到呢個變種係點樣咧？最初喺武漢嗰個病毒咧，佢呢3個咁嘅掌咧係即係合埋一齊嘅，冇打開嘅。咁但係當佢一個慢慢適應咗之後咧，佢有一個咁嘅能力咧係變咗，而家咧係識得打開。
The second mutation is called the D748k mutation. This is the one they found a way to attack our lung cell. So that's really the beta from South Africa. Somehow merge with Delta, that's the Delta plus. Learn how to attack our lung cells.
咁而家第2個咧就係我哋話叫做一個嘅Delta， 再加埋南非嗰個病毒加埋一齊叫 Delta plus。佢哋係點咧？就係特別識得嚟到去攻擊我哋喺肺部嘅細胞嘅。
And then the third mutation of the Delta variant is the P681R. I call this the key turn mutation.
第3個咧就係一個 P681R 嘅變種病毒啦，就係一個叫好似鎖匙或者會轉嘅一個嘅變種。
What does that mean? Okay, you know how you open up a door, right? You stick your key into your door, you turn it, then you can open up the door. So what the P681 does is the virus learn how to stick their polymer into our cells smoothly and turn and open and get in. Just like, let's say our keyhole is round and the virus is triangle. It's harder for it to go in. But the P681 mutation, from triangle, they become round, so they can go in easily.
呢個咧就更加厲害啦！呢個變種，譬如咧就好似我哋嗰個門口嗰個鎖咁樣，假設嗰個門口個鎖個窿係圓形嘅，咁而本身呢個病毒咧係三角形，咁呢個變種咧佢就知道，如果嗰個門口嗰個門鎖個窿係圓形嘅時候咧，佢自己識得由三角形變成圓形，以至到佢好似一支鎖匙咁樣可以開到嗰個嘅鎖。
Now, so the virus is pretty smart, right? But human being, our scientists are pretty smart too. God gave us knowledge to able to see that, right? So if you look at the next slide, the vaccine, give you antibody. The blue picture here is man-made antibody or cause your body to produce these antibodies.
雖然我哋嘅敵人咧嗰啲嘅病毒咧係好犀利，咁但係上帝咧亦都俾人類咧有聰明智慧，有普世嘅恩典啊，即係俾我哋咧識得透過呢一個發明呢個疫苗咧嚟到係對抗呢一個嘅病毒。
So what you see is these antibody created from the vaccine, and these antibody actually able to form a shape blocking the spike protein. Because of that, the cell blocking it, it's like a wall so that the spike protein cannot get into our receptor.
咁呢個嘅疫苗咧就係俾我哋有個抗體，就好似藍色嗰度啦，就係當嗰啲嘅冠狀病毒要嚟到去攻擊我哋人類細胞之前咧，佢好似一個城牆咁樣嚟到去阻開或者係分隔嗰個病毒，咁變咗咧佢唔能夠去攻擊我哋嘅細胞。
But on the other hand, the virus become pretty smart too. So what it does is virus decide to drop one of the area of the spike protein called the N-terminal domain. So this is like this part right here, the virus learned to drop it from the spike protein. Therefore, when the antibody that we created it cannot latch onto it close because one part is missing. So this become unstable. So once again, they're able to attack to our cell.
咁你知道敵人咁梗係唔會咁容易放過我哋啦。咁所以當佢見到有一個嘅抗體嘅時候咧，呢個冠狀病毒咧就其中3個手掌，其中一個咧就會好似斷開咗跌咗落嚟，咁跟住咧好似空降咁樣落咗嚟啲人類嘅細胞，想嚟到去攻擊我哋。
So that's why the reason why the antibody doesn't work well anymore to block against the infections of Delta.
呢個亦都係呢咁嘅原因咧，就係話點解我哋嗰個嘅叫做疫苗咧，唔能夠有效去對抗呢一個嘅病毒嘅原因。
But interesting, don't get worried, right? So we're going to take a look, vaccinated and not vaccinated. But we found from the last few months, those who are vaccinated, you have 8-fold less chances to get infected. You will get infected, but the chances you are 8 times less than somebody who are unvaccinated.
咁過去呢幾個月咧，話俾我哋聽，科學話俾我哋聽咧，數據話俾我哋聽，就係你如果係接種咗疫苗咧，你只係1%嘅可能性咧，相對於其他人咧係會受到感染。
And you have 25-fold less likely being hospitalized or even death if you're vaccinated versus somebody who are unvaccinated.
同樣地，嗰啲接種咗疫苗嘅人，只係即係有一個人裏邊，即係25個人裏邊，只係有1個咧係有咁嘅情況，係要入醫院或者係甚至乎過身嘅，即係相對於嗰啲未接受疫苗嘅人
25倍。25倍少啲機會 right?
Yeah, 25. Yeah.
And therefore, you look at it, that's why people who are hospitalized in the total people who are hospitalized, 90 to 97% are unvaccinated.
所以因為咁嘅緣故咧，我哋都睇到咧，入院嘅人係有 超過90%啊，其實係97% 咧係嗰啲未接受疫苗嘅人。
Then you will say, hey, it doesn't make sense, right, Dr. Yu? Earlier you said the antibody doesn't work. If it doesn't work well, how come we have these better outcome?
係啊，咁睇就咁聽咧，好似同之前啱啱講嗰啲有少少唔配合喎。因為之前講話，就算打咗疫苗咧，都有可能嗰個病毒咧係會好似掉咗個手掌落嚟，繼續嚟到攻擊我哋。
Then, of course, you have to understand how the vaccine works. The vaccine is not as simple as just created antibody. There's more to the vaccine than antibodies.
咁原來咧，我哋要知道嗰個疫苗咧係除咗有抗體之外咧，亦都有其他嘅作用。
So I like to use another analogy. The vaccine will give you something we call B cell response and a cell-mediated T cell response.
原來呢個疫苗咧係會俾到我哋有兩方面嘅反應嘅，一個咧叫 B 細胞，另一個咧叫 T 細胞嘅反應。
So the analogy I'm going to give you is B cell is similar to a Great Wall, 萬里長城, our Great Wall.
B 細胞咧就好似中國嘅萬里長城咁樣。
So that's to block the virus from coming into us, to block our enemy from coming in.
好似一個防火牆，即係唔俾嗰啲敵人嚟到進攻。
Those who came through the wall, we have our soldiers, we have our army to fight it. That's the T cell, the CD4.
咁至於嗰啲話有部分咧係可以入到我哋身體嘅細胞，因為個疫苗咧有另一種叫做 T 細胞，嗰啲咧就係我哋身體裏邊嗰啲咁嘅即係嗰啲嘅軍隊嚟到去打嗰啲嘅敵人。
So you might remember back in the early days when we get the vaccine, Moderna said they can protect you 94.1%, and Pfizer said we can protect you 95%. So that means there's 5 to 6% can go through the wall.
大家都仲記得你去打疫苗嘅時候咧，Moderna 咧就話咧你係嗰個成功率咧94%，而輝瑞咧就話95%。換言之咧係有大概5至6% 係仍然有機會受感染嘅。
And somebody earlier asked a question, how about now against the Delta? Well, the Delta, I'm going to tell you, Moderna still have about 76% protect you, and Pfizer is about 42%.
咁至於呢個 Delta 變種咧，就係 Moderna 咧就可以抵抗到76%，而輝瑞咧就係42%。
So that means you have a 24 to 58% that they can break through the wall.
所以換言之咧，佢哋仍然有24%到58%嘅機會咧，係即係可以突破到呢個城牆。
But how come we have an 8-fold less infection and we have a 25-fold less hospitalization because we have an adequate army to fight for us?
但係點解我哋接受咗呢一個疫苗嘅人咁少係受到感染咧？就係因為正正我哋身體裏邊有呢一個 T 細胞嚟到去打呢個病毒嘅。
That means if you are the unlucky 5 to 6% from the original virus, which we don't see anymore, if you are the unlucky 24 to 58% of the Delta, you're not going to get too sick.
所以如果你係不幸地咧係嗰24%到58%啦，係受呢個變種病毒影響都好，咁我哋因為身體入邊有 T 細胞咧，就我哋嘅病情同埋病徵都係會輕微好多。
Therefore, vaccination surpass non-vaccination patients.
呢個亦都係解釋同埋總結咗點解接種疫苗嘅人會往往係比未接種嘅人咧係好多嘅原因。
And then I like to have a patient, I try to convince her to get her vaccine. She haven't get her vaccine yet. And I said, why, Mrs. So-and-so, how come you don't want the vaccine? She said, I don't want it because it's not fully studied. There's too many side effects and I don't want it. But I'm okay. I stay home. I don't go out.
我有一個咧病人咧，我就即係嘗試說服佢嚟到打疫苗啦。咁咧佢話點都唔打啦。咁我問佢點解咧？咁佢就話咧佢唔想有呢一個嘅受一啲嘅副作用，同埋呢一個疫苗咧，亦都冇一個好全面系統性嘅研究，所以我就唔打啦。咁我留喺屋企就得㗎啦。
So I asked her, "You don't go grocery?" She said, "No, my husband go. He's vaccinated, so he will go and get all the grocery and does everything."
咁我問佢啦，咁你唔去買餸嘅咩？咁佢就話我會嘅，不過唔係我去，係我老公去嘅，佢已經咧係打晒疫苗㗎啦。
But I told her, your husband, because he is protected, but he can carry the virus home, and you get the virus, you don't have the Great Wall, you don't have the army, and she will get sick.
咁咪做乜啊你？
咁我就話俾佢聽，咁冇錯，你先生咧打咗疫苗，但係咧佢仍然係有機會嚟到係受感染，同埋會傳播俾你嘅。咁你咧因為你冇嗰個萬里長城，你亦都冇嗰個軍隊嚟到保護你，咁所以咧你都係好危險嘅情況。
That's why those who sick in the hospital is ranging from 90 to 97% right now.
所以而家亦都解釋咗點解喺醫院入邊嗰啲人咧係90%至97%都係未打疫苗嘅人。
And the final slide I have for you, this is a war against an invisible enemy.
最後一張啦，嘅投影片就係話呢一個咧就係同一個隱形嘅敵人打仗。
We have a very powerful vaccine that in human history, we never have such powerful vaccine. Unfortunately, people don't trust it.
我哋有一個我話叫做前所未有咁強勁嘅疫苗，但係個問題咧就係我哋人類好多唔相信呢個疫苗嘅功效。
To win the Delta War,
我哋點樣去打贏呢個叫 Delta 嘅戰役咧？
Going to get the vaccine right now is a little bit late.
如果而家去打疫苗，可能比較遲一啲啦。
Because it takes about 6 weeks before you're protected.
因為咧要6個星期咧，你先至係得到保護嘅。
There's a patient in the hospital, a 38-year-old got sick in the hospital.
有個病人30歲喺醫院嗰處。
He asked one of my colleagues to give him the vaccine now.
佢就問我嘅同事啦，可唔可以幫佢打疫苗啊？
It's too late. He got infected. He had to wait. He survived. If he survived, he can get the vaccine 9 months later.
So 佢要等。
Not 9 months, 90 days later.
佢要等啦，但係咧就對於呢個 Delta 咧就幫唔到手，佢要等90日。Yeah.
How do we fight the Delta? We have to masking again, social distancing, avoid large gathering, frequent testing. Doesn't matter you're vaccinated, not vaccinated. And if you test positive, quarantine for 10 days.
有咩可以做咧？戴口罩、社交距離，避免多人。我哋去經常去檢驗啦，同埋咧，如果你確診咗咧，就要去隔離啦。10日左右。
And the Delta will peak, just like in India and in UK.
呢一個嘅 Delta 咧會去到一個高峰嘅時候，就好似喺英國同埋印度嘅情況發生一樣。
And hopefully we won't sacrifice too many people.
希望就唔會有太多人係犧牲咗。
How can we win the COVID war?
我哋點樣可以打贏呢一場嘅冠狀嘅戰役咧
We need 90% of worldwide vaccination, not just United States.
我哋需要全世界90%嘅人口係接種咗呢個疫苗。
Unfortunately, in the United States, we have plenty of vaccine, but people refuse to get it. Other countries are dying for these vaccines.
喺美國好可惜，我哋有好多疫苗，但係好多人唔會打。而相對地，其他地方有好多人想打，但係又唔夠疫苗。
To win the war, we need to continue surveillance of new variants.
咁當然，我哋亦都要繼續嚟到去監測跟進呢一個嘅疫情嘅變種。
And scientists have to keep up the mutation and build better antibodies, better vaccines.
而科學家亦都會繼續去就住嗰個疫苗啦嘅需要同埋發展，特別係嗰個嘅病毒嘅演變種咧嚟到去按住嗰個嘅情況嚟到去調教我哋嘅疫苗。
We have a great wall, but we need to build a stronger wall and higher wall.
我哋冇錯已經有好似長城咁樣咁，但係咧我哋要更加強、更加高嘅城牆。
And to win the next variant war,
要贏下一個嘅叫做變種而嚟嘅戰役係點樣咧
we need to prevent more infection. The more infection there is, the more mutation it will be.
我哋要盡可能去減少大規模嗰個嘅傳播，因為越傳播得多，嗰個病毒咧就越變種得犀利。
Mitigation, prevention is the key.
緩和啦、減輕啦，同埋咧防範都係好緊要嘅。
Guess who is coming? Lambda from Peru in South America are pretty strong right now.
乜嘢係嚟緊嘅變種咧？就係喺秘魯嚟嘅，呢個叫做 Lambda。
We don't know it's going to come to the United States, but we are so close to them. We might. The only way to go is really vaccination.
我哋到目前為止都未知佢會唔會嚟到美國，但係我哋知道喺秘魯咧影響就好大。咁同埋我哋知道就係接種疫苗對我哋係好大好大嘅幫助。
Okay, that's all for today, and I'm open to questions.
Okay, thank you very much. 再一次咧，多謝余醫生好詳盡、好精簡、好深入淺出、好精彩嘅即係呢一個嘅講解。Thank you very much for the very detailed, thorough, and interesting as well presentation. And at the same time, it's a very daunting task. We have to really take it seriously. Okay, we got some questions here. 我哋有問題嘅時間，咁大家咧可以透過嗰個 chat room 咧將你嘅問題打出嚟。You can through the chat room type out your questions, so we'll answer that. Okay, next one is the let's see. I took the Moderna before some side effects. If third shot is available, can I take Pfizer because my other family members had no side effect, or I have to take Moderna or no difference? 即係廣東話嘅翻譯啦，就係我咧就打咗2針呢一個叫做 Moderna 嘅疫苗。咁如果第3針係即係我哋可以打嘅，咁我應該係打翻 Moderna 定還是我係打輝瑞嗰隻咧咁樣？
Yeah, so far CDC haven't permit mixing vaccine yet. So if you get Moderna, you should get Moderna. Even just last week, they promote people who are immunocompromised can get a third dose. Not everybody, right? So these are the ones that cannot build up a good army, the CD4. Either they are cancer patients, they are transplant patients, they are allowed to get the third booster dose. It's the same vaccine, it's just a third dose to build up the immune system. Again, CDC said if you have Pfizer, you get Pfizer. If you have Moderna, you get Moderna. So right now, the safety of mixing vaccine, we don't know yet. Until it's proven that we can mix and it's safe to do so, then we will allow to do so.
根據美國政府 CDC 嘅指引咧，而家都係你打開邊一隻疫苗就係繼續打翻啦。如果你用輝瑞嘅就繼續用輝瑞，用 Moderna 就用 Moderna。咁到目前為止，佢都冇批准你可以用即係好似頭先講唔同嘅疫苗。唔同公司嘅疫苗，咁所以我建議就係大家跟翻你本身用開邊一隻疫苗就繼續嚟到打。咁至於話邊一啲人需要打第3針咧，其實未係所有人需要，而係嗰啲咧有身體有狀況，有一啲譬如話嚴重嘅疾病嘅人咧，佢哋先至需要嚟到去打一個第3針即係加強嘅針嘅。Okay, next question 就係。為什麼年輕人打疫苗後容易得心肌炎？ So the question is why the younger generation of people after the vaccine is having higher chance of inflammation in the heart?
Yeah, cardiomyopathy. We've seen it in kids that are getting vaccine. Some of them get cardiomyopathy. It's an inflammation or enlargement of the heart. They don't know what really causes it, but on the other hand, most of them are done really well. So the number of bad complication is not that high. And again, the cases I see, they all recover. So the vaccine is a very powerful vaccine. It causes our body to do a lot, mainly causes our body to create all these spike protein, just the spike protein itself. And because of the spike protein, our body create antibody to destroy them. So the spike doesn't last in our body too long, but the antibody will last. So they are unknown. If you look at vaccinations, not just talk about the COVID vaccine, you talk about the flu vaccine. Every year we do complication. You talk about the measles, the MMR vaccine, but the percentage is low, and therefore the outcome is greater. We do have side effect even for the Moderna seems to be more side effect than the Pfizer. But on the other hand, most, I would say, these are short-lived. People recover from that. But if you catch the COVID-19 or the Delta variant, there's very well, you might not recover, even death. Those recover, we have something called COVID long. They have symptoms for a long time. Usually by definition, it's 6 months. They still have symptoms up to 12 months.
好，個答案咧就係冇錯係有一啲個別嘅情況咧，特別一啲小朋友會有心臟嘅發炎或者咧心臟會稍微大咗少少嘅情況發生。咁但係咧呢一啲數字咧都係好個別好少嘅情況。咁絕大多數咧都係冇咁嘅情況，同埋依家科學家都未係好知道背後嘅原因係點樣。咁但係我想強調嘅就係任何一種疫苗咧，包括咗你打嗰啲傷風感冒針咧，都有可能會有一啲嘅副作用。咁但係嗰個相對於個疫苗帶嚟嘅好處或者幫助咧，係遠遠大過你冇去打疫苗，或者係一啲有可能有個別嘅情況係有副作用嘅情況嘅。咁所以我都仍然係鼓勵大家，你可以接受疫苗嘅時候咧，就去接受呢個疫苗。OK， 好 ，next question is how you got the number of 90% as a benchmark of herd immunity. Seems ID specialist has diversity on this. 咁呢個問題咧就係問阿余醫生，你點樣可以有嗰個叫做90%嘅人，如果打咗疫苗咧，就有一個群體免疫嘅咧？
You know, actually, it's not 90%. If you look at it, previous data say about 75 to 80%. However, when we start having variants like that, that number doesn't work anymore. If the variant can cause those who are vaccinated still infect others, you're not going to get herd immunity, right? Herd immunity is either you got the disease and you're protected by the vaccine and you won't infect others. But now the Delta proved that doesn't work. We all vaccinated, we still can get the virus. We still can pass it to it, right? So as long as we are not able to achieve nobody get infection, we will never get to that point. In my true opinion, we will not be able to get rid of COVID-19 or this virus. We could have a chance to do so, but that chance, I think the variants are so rapid in coming, the variant keep coming, right? The more infection you have, they're gonna mutate. The virus mutates so quickly, and then we just have to keep up. Just like influenza, right? We have H1N1, N3, N2. We have to keep up with a vaccine. And in my opinion, this is the world that we're gonna have, right? But on the other hand, if we can really able to stop the infection, completely stop, just like measles, like chickenpox, smallpox, we can stop them. While they were young, we make all the kids to get the vaccine. These infections are stopped and they're no longer mutate. Smallpox is gone, right? We're able to immunize the whole world, right? Only research people have the smallpox. So it's so hard when you talk about virology and bacteriums, and they mutate, and that's the main thing.
好，個答案咧就係如果你諗翻轉頭，最初啲專家話點樣為之群體免疫咧，係講緊75%至80%嘅人打咗疫苗就得啦。咁但係如果你睇個 Delta 嘅變種病毒咧，事實上就算係90%都仍然係會有傳染嘅。咁所以從我嘅睇法咧就係基本上咧就最理想就係所有人都打晒疫苗啦，咁先至有能夠咧去降低或者係減低嗰個嘅變種嘅情況。咁換言之咧，就係基本上呢一個病毒會繼續同我哋一齊叫共舞啊，一齊存在。咁我哋咧我嘅建議咧就係大家盡快去盡可能咧就去打疫苗，變咗咧佢繼續去演變、繼續去變種嘅情況就越嚟越少、越嚟越慢啊，咁樣先至咧我哋可以嚟到去處理到嘅。就好似我哋其他譬如話天花啊或者其他一啲嘅情況咧，我哋都係要慢慢透過一段時間打咗疫苗之後咧，咁先至受到控制。Well, next question is a heart disease patient qualify for the third shot at this time? 一個有心臟病嘅病人係咪可以打第3針咧
Not yet. Yeah, so CDC, they only came out this last week, right? At the 12th of August, really are for people who have immunocompromised. So they're very specific. Those who are under treatment for cancer, not previous cancer recover, under treatment for cancer, people who are on suppressive drugs, people who are transplant patients. So they're very specific who to get it. And as time goes on, I think they will allow more and more people to get it. But as of now, people with heart disease, diabetes, hypertension, and these are not part of the high-risk patients.
到而家為止，譬如話你係心臟病啊，或者係糖尿病等等咧，都未係合乎資格去打第三針嘅。咁係嗰一啲叫做高危嘅人啦，就包括咗咧係有癌病嘅人啦、變性嘅人啦等等咧，喺而家啱啱最幾日前政府公布咧係可以去打第三針。咁而我亦都相信喺不久嘅將來咧，慢慢政府都會俾其他可能心臟病啊或者其他啲嘅病人咧係可以去打第三針嘅。呢個係我嘅睇法。好，next question. What about natural immunity? They should be protected too without getting the vaccine, right? 咁呢個問題就係話叫做天然嘅免疫會唔會有呢樣嘢咧？咁樣。
We wish there's there. The study now show that some of the variant doesn't. Definitely the Delta variant can get somebody who already get previous type of COVID-19 sick again. So we know the South Africa, the Beta, they have reinfection. We don't see much reinfection in people who have the Alpha or the original strain, but then when they catch the variant strain, and there's more, these variants are coming. So I think you will see reinfection more and more. So there's no lifetime immunity.
我都希望有嗰個嘅咁嘅情況發生，即係話天然嘅免疫能力。咁但係從我哋啲數據睇到就唔係咁啦，即係包括咗喺非洲嗰個叫 Beta 嘅變種病毒啦，有人咧係再一次嚟到感染，因為個情況就係嗰個嘅病毒咧係會只係越嚟越嚴重，越嚟越變種得犀利。咁所以咧，如果你係之前係OK 嘅，咁但係而家咧亦都係有可能會再一次係受感染。
Yeah, just clarify, not all the variants are powerful and deadly. Some variants, sometimes they mutate to some that are weak and our body can get rid of it. But once in a while, like the Delta becoming a dominant strain, Delta win over all the other variants in the United States, including Alpha, including Iota, all those are wiped out by Delta.
係啦，我要補充少少咧，解釋翻，就係唔係所有變種咧都可以打低我哋嘅，即係好似唔係所有敵人咧都可以攻擊到我哋一樣啊。咁但係有一啲嘅敵人咧就可以即係擊到我哋嘅要害啦，叫做即係譬如好似 Delta 咁咧就可以好致命啦，影響我哋好犀利嘅。咁我要即係澄清翻呢樣嘢。好，下一個問題 ，next question， does the effectiveness of vaccine fade with time？即係話呢一個疫苗會唔會隨時間嗰個嘅有效性會減低咧？
Yeah, we definitely see that. That's the reason why you look at the Pfizer, as I mentioned, against the Delta, is 42%, and Moderna right now 76%, and it does drop. Reason is not because the Delta have mutated to the point that can stand against our antibody, but at the same time, I think the antibody that we caused by the vaccine also start fading also. So again, the vaccine is not going to be one shot and forever like your hepatitis A vaccine or hepatitis B vaccine. Those you get one dose, or your pneumonia vaccine, or even your shingle vaccine, right? You get one dose. Time will tell. Just like the shingle vaccine, when it first came out in 2006, it said one dose of the Soslavec lifetime. You're 6 years old, you get one dose. But the study showed 10 years later, 50% of them doesn't protect them from shingle anymore. Then came the Shingrix, which came along in 2018, 2 doses, and they say that's lifetime, right? If you're 50 or older now, you can get it. But again, time will tell. But in my opinion, these vaccines will fade.
係，我同意嘅。呢一個嘅疫苗咧，會隨住時間個有效性會減少。咁呢個係我同意有咁嘅情況，因為再加上嗰個病毒都會變種嘅緣故，就好似咧，其實我哋知道咧有另一啲嘅叫做好似打蛇針嗰啲啦。最初佢開始出嚟嘅時候咧，佢哋咧就話打一針就得㗎啦。咁但係咧喺2017年度咧，應該就係咧佢話咧而家要打2針先至有效。咁但係我哋知道嗰個嘅叫做有效性咧，同樣嗰個冠狀嘅疫苗亦都係咁樣嘅，即係我都唔否定將來可能我哋要再打其他嘅針，但係只有時間同埋嗰個嘅數據先至可以話到俾我哋聽，將來係咪需要打第3針，譬如話或者係嗰個有效性係去到幾多？Okay, next question is please clarify what? I don't know. And vaccine fade. What is vaccine fade? I think that's okay. Next one is the J&J vaccine effective against the Delta variant. 就係呢一個嘅 Johnson & Johnson 強生嗰隻係咪對 Delta 變種咧係有效咧？
Yeah. So Johnson, even in the beginning, it's 1 dose. People like it, just 1 dose, but only give you 72% protection in the original virus versus Moderna and Pfizer, which give you a 94 to 95%. However, if you look at people who have those vaccines and get sick, they are still protected. Again, you have to look at not just the antibody response. They are able to fight the virus and we won't get that sick. Although some people are concerned, in San Francisco, actually there are places in public health that will give you, even J&J, they will give you a 1 dose Pfizer on that. Now, again, I'm going to name that is not approved by CDC. And San Francisco County Public Health, sometimes they will do that. And sometimes they will ask you to go back to your primary to get that. But in my opinion, as long as it's not approved yet, I wouldn't do it.
OK， 咁要講翻啦，因為強生呢個疫苗咧，最初嘅時候好多人中意，因為只需要打1針。咁但係咧，我哋都知道咧，佢嘅保護率只係70%左右，而另外嗰2隻咧，強生同埋 Moderna 咧就係94%、95%嘅。咁呢個係第一點啦。第二點咧就係縱然就算好似頭先我用嗰個比喻，嗰個疫苗咧係有2方面，一個就好似長城咁樣，另一個咧就係好似一個身體嘅細胞嗰個軍隊。咁就算你係感染到都好，咁但係因為強生咧仍然咧好似有個軍隊咁樣嚟到去保護你嘅，咁所以我係即係覺得係冇問題。咁當然我都聽過喺三藩市咧有一啲地方咧，你打咗強生，佢亦都會幫你打1針 Moderna 或者輝瑞。咁但係我嘅睇法咧就係因為呢一個做法都未係政府 CDC 嚟到去批准嘅，所以我都唔建議咁樣做。Oh, next question. You said most people without the immune problem do not need the 3rd shot, or is it that most people without the immune problem cannot take the 3rd shot? Yeah.
Let me clarify the questions again. It's people who have good immune system doesn't need the 3rd shot, right?
Yeah, most people without the immune problem do not need the 3rd shot. It's double negative. Yeah. Mm-hmm.
So far, they haven't recommended yet, because again, the primary reason for the vaccine, we hope it will prevent you from getting infection. But the primary thing of the vaccine, the goal of the vaccine, is make sure you're not too sick. You don't need to be hospitalized. Why? Because if you flood the hospital, if we flood the hospital, like certain state right now, they're in trouble because all the patients going into the ICU is all COVID patients. People with heart attack, people with other disease are not being admitted or hard to find hospital space for them, right? So the primary reason for the vaccine is to prevent people from getting really sick and prevent you from going to the hospital, and mainly, most important, prevent death. So do we need a 3rd dose for people who are overall pretty safe, already have 2 shots? We might not need it yet. But I think, in my opinion, eventually they will allow that. But for now, if you have good immune system, you got 2 vaccines, you're pretty safe.
大家要知道疫苗嗰個嘅目的係啲乜嘢？係有2方面嘅。第一就係避免要入醫院，第二咧就係去減低嗰個嘅病情。咁所以因為咁嘅緣故咧，我睇法就係並不需要嚟到去打第3針。如果即係呢一個疫苗係已經可以做到呢2方面嘅效果嘅時候，冇錯，就算我哋可能有機會受感染都好，但係嗰個病情同埋病徵都係受到控制同埋輕微嘅。咁呢個我嘅睇法。Okay, because of the time limit, let's finish these questions very quickly. All right. What do you think about going out to eat in restaurants, whether the restaurant need proof of vaccines or not?
Well, right now, if you're in San Francisco, you need to be proven going to a restaurant, to a bar, even to my office, you need to be proven you're vaccinated. In my opinion, that's a good idea. The reason is not because of us. I think in San Francisco, we're pretty good. We're 80% vaccinated. Now, when the summertime comes, we have tourists. We have these people coming from Midwest who are not vaccinated. We don't really want them to bring the virus here. So they have to prove to be vaccinated. And we cannot close San Francisco border, right? We cannot say, don't come, we're all vaccinated here, you stay away, right? We cannot do that. So now I think the city is moving to that direction. We want to make sure these people are safe to come in, and they need to be proven to be vaccinated.
我嘅睇法咧就係我都同意嘅，即係話去一啲嘅地方餐館啊，甚至乎去我診所咧，我都建議啲人咧係有嗰個打咗針紙疫苗嘅證據嘅。咁雖然我哋三藩市嘅人咧都係大部分都已經打咗疫苗啦，咁但係我哋唔知其他外嚟嘅人會唔會有咁樣做。咁個目的咧都係希望嗰個嘅病毒唔會繼續嚟到去傳播。咁所以我嘅睇法係支持呢個做法嘅。Okay, it appears the situation in India is under control. How did India take care of the spread of the Delta variant?
No, actually, India burned through it. We call burn through. Burn through is you have so many people, so many sickness, they die, they get sick. There's no other people for them to infect. And then the virus is slowly. So they peak and they down, but they sacrifice a lot of people, right? So we don't want that. We don't want our peak to be 400,000 people. And we hope we won't get to that point, but we're hoping it will peak soon. Yep.
我就形容呢一個咧，好似一個災難性咁樣嘅情況喺印度發生，即係佢哋已經係傳播到一個地步咧，係冇得再傳啦。咁所以咧係先至慢慢嚟到去降低個數字。當然我唔希望我哋有咁嘅情況啦，每日有成40萬嘅人咧係受感染嘅。Okay, because of time, let me take this 1 to 2 questions. Let's see. Ken, what's your take of checking antibodies after vaccine? For against visitor to Hong Kong, they shorten the quarantine to 1 week if you have the proof of antibodies. Is that 1 week or 2 weeks for Hong Kong?
Yeah, so you can definitely do an antibody test, IgG, right? The test doesn't tell you if you are from a natural infection or you got the vaccine. So all you can tell is you have antibody in you against COVID-19. So I don't know if Hong Kong using that as a mission to it or proven a vaccine. So it's really hard to say. Just like give you an example of a patient who thought she might have COVID, 4 or 5 months ago, but she vaccinated and she asked me, Dr. Yu, I want to check my antibody. I said, I can check it, but the antibody didn't show me that you had the disease or the vaccine give you antibody. I checked it and she had antibodies, but that doesn't answer her. Did she get sick back in a few months ago? Did she have COVID, right? So I think the antibody test is not as useful as what we think it is.
Okay, 呢個咁嘅測試咧就唔能夠話俾佢聽嗰個嘅歷史個病歷係點，只能夠咧話俾你身體裏邊咧有冇嗰啲嘅抗體嘅啫，咁所以佢係有一定嘅限制嘅。最尾一個問題，咁不如阿 Eva 你係咪有問題啊？見你舉咗手。 咁不如俾余談問啦。OK。
唔該，余醫生。咁咧，因為而家啲變種病毒咁犀利咧，咁好似睇嚟嗰啲疫苗都幾少嗰啲可以控制嗰啲變種嗰啲疫苗咧。同埋咧，前排話有隻 Laura 嗰隻疫苗，但係而家 N 字頭 NO 乜鬼喎3月嗰時就聽講有嗰隻 Law 係啊，嗰隻 NO 嗰隻唔知而家都未聽到係幾時出得嚟，嗰隻係咪可以防治嗰啲變種病毒咧？
我諗你講嗰隻係 Novavax，right？Novavax 係打呢個spike protein 呢個刺突蛋白入去身體，然後等身體做個抗體出嚟。咁當然啦，呢個刺突蛋白咧，如果你而家 Delta 都抵擋到普通啦，所以我覺得咧都唔會防到呢個 Delta。不過最主要就知道，如果你打到 vaccine 嘅話咧，你係會有機會染上冠狀菌，但係你嚴重嘅病同埋入院嘅機會咧係減低非常好多。咁所以咧，將來可能我哋第啲 vaccine 咧係會對付呢 variant， 但係就算對付呢個 variant 嘅話，你下個 variant 咧又要追上去啦。即是話 Pfizer 同 Moderna 本來做咗個抗體出嚟，唔係個 booster， 係要嚟抵擋呢個 alpha 嘅。alpha 你而家已經唔喺度啦 ，alpha 已經對我嚟講唔重要啦，嗰個唔會抵擋 delta。如果你而家做個 delta 出嚟咧，如果將來呢個 lambda 係犀利嘅話咧，我哋又遲一步啦。所以但係唔好唔記得，我哋唔係講個 antibody， 你打咗針之後咧，你最少你仲有個 army 幫你打呢個。所以 overall you are safer 但係咧唔係十全十美。我哋最好就唔好俾個菌入我哋添嗰度先，即係我哋有條萬里長城係最好嘅。但係 sometimes it doesn't happen。如果佢猛咁mutate嘅話，right？
Okay, thank you。
好，唔該晒。Okay, I think time is up, and thank you again, Dr. Yu's very helpful, very insightful presentation and answering questions. So if you have further questions, you could find a way to outreach to him, I believe. And also you can talk to us from the church. 再一次咧，多謝阿余醫生啦，俾我哋咁好精彩、好仔細嘅分享同埋分析，幫我哋更加進一步明白嗰個嘅病毒同埋嗰個嘅疫苗對我哋嘅幫助喺邊一方面。And again, I really appreciate Dr. Yu when he points out the enemies. So we all have different sorts of enemies, and yeah, so it's by the creation of God, we have certain immunity. But at the end of the day, is only coming back to the grace of God. He is the one truly helping us to defeat all of our enemy, which is sin against everything. 好，最尾咧，再一次多謝余醫生啦，提醒我哋，其實我哋都係每個人咧，都係喺呢個世界入邊，唔單止係有好多嘅病毒，呢個世界咧，亦都係被罪惡嚟到感染。唯有喺耶穌基督嘅恩典，唯有耶穌基督嘅拯救咧，先至能夠救我哋脫離一個兇惡嘅世界。所以最後都係願意神嚟到祝福大家，希望大家能夠認識我哋耶穌基督嘅救恩。Last but not least, may you all be blessed and experience the powerful salvation and the good news, which is so important for all of us. 再一次多謝大家嚟到參與，希望下一次我哋嘅活動能夠再見到大家。Thank you once again, everybody, and hope to see you again in future. God bless you. 願神祝福大家。拜拜。
拜。
Thank you. Bye bye.
Thank you.
Thank you. Bye bye.
Thank
Thank
you.
you.
Thank
Thank you,
you.
醫生，唔該。
Thank you.
Thank you. Bye bye.
Bye.